Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Hello, my name is Mina White, and I am the RPE program evaluator with the California Department of Public Health. So this is Rape Prevention Education, Finding What Works. Along with me is Sabrina Boyce. She's with the University of California, San Diego, Center on Gender Equity and Health, and I'll let her kind of introduce the other people that are involved in this project with the RPE supplement and the RPE toolkit that we've developed. Also at the California Department of Public Health that assisted with this project is Francisco Michel. He is back here. He is the RPE coordinator for California. And I'll let Sabrina just introduce a little bit about her colleagues at UCSD.
Thanks so much. So again, I'm Sabrina Boyce, and with UC San Diego Center on Gender Equity and Health, and we have a research team there that focuses on a lot of issues around violence against women, both domestically and internationally. We also do work around reproductive and sexual health. And our team there is led by Dr. Jay Silverman, and I manage a variety of his projects. And then we have a team of both staff and graduate students that have helped us out with this project, which include Ruvani and Ricardo from our team. So they are behind this work too as we speak.
So before we get started, I kind of wanted to get a sense of who's in the room. This is great that there's so many people here. I thought no one was going to show up, and there were so many people. Who here is from like an RPE coordinator or director for the state? Okay, it's good to see. And then who here is from like a rape crisis center or a local agency? And who here is funded by RPE? Oh, okay. Who else is here that I missed? Public health, yes. Who else is? Coalition, yes, I missed coalitions. Yes, how many coalition staff are here? Oh, great, okay. How many people here are like evaluators or epidemiologists or data people? Okay, good. Okay, so that's great. So we can kind of cover all of you and try to include you in our conversation here. So before I get started, I'm sure most of you kind of know about the RPE program, especially those that are funded with RPE funding. For a little bit of background, the RPE program is funded by the CDC. The vision of the RPE program is to prevent first-time victimization and perpetration. So this is what we call primary prevention, rather than services for people who've already been victimized. The RPE program really intends to approach sexual violence from a public health perspective. So it's really the funding that comes down from CDC through our California Department of Public Health, and then from there we fund rape crisis centers around California. So with this program, we really address social norms and community, and those play a huge role in preventing sexual violence in the primary prevention of sexual violence beyond the traditional role that is usually played by the criminal justice system. A little bit more of the background is that currently we fund 33 rape prevention and education projects throughout California. There are 63 total rape crisis centers in California, so we currently fund 33 of those. Most of these projects are school-based. We also have a number of community-based programs as well. And in the last few years, there's been really a focus in shifting towards better evaluation, more rigorous evaluation, and really evaluation that from a statewide and state level, rather than having every one of these programs conduct their own separate evaluation. So along with that, there's been a big concentration, especially on how to measure community level change. This has been a huge topic in the last few years. It's definitely a really difficult thing to capture. This is something that we'll have some discussion later on about, maybe get some of your ideas even on how you think that might be possible, and what your ideas on how to capture community level change. So the purpose of the RPE evaluation supplement was, this is also funded by the CDC. They provided some additional funding to California to expand upon our state level evaluation capacity. So the intention of this funding was to increase the capacity of us at the CDPH level to conduct the evaluation. With that, we really wanted to increase the monitoring of the state level indicators of some of our outcomes on sexual violence. And the supplement states were expected to really add and expand their outcome evaluation activities. With that, they also really wanted to expand the strategies that were specified in their evaluation plans. These are the 12 states that were funded with the RPE supplement. And just to go over a little bit about what the project does not do is that CDC had some restrictions on what we were really focused on with this project. The supplement did not focus on evaluating specific strategies, like we didn't get funding to really actually evaluate programs that were on the ground at local level. This was not to conduct research. We didn't collect any actual real evaluation data for any programs with this funding. And it was not intended to demonstrate the impact of the RPE program or attribute any changes that we saw in our data to the RPE activities. So basically, it wasn't to actually do any evaluation, it was to build our evaluation capacity. What the project did focus on was improving our state level outcome evaluation. So like again, we were really, this project was really intended to build our capacity to track indicators. With that, we really sought to identify these publicly available data sets for use in evaluation and to look at those to connect to that local level to see how those two connected. We, in California, really wanted to use this funding to look at both qualitative and quantitative methods to do this evaluation because we realized that there are a lot of things that qualitative data can capture and a lot of other things that were specific to quantitative data, but putting those two together really could help us tell the story of what was happening throughout our state in California. So we really wanted to use this supplement opportunity to describe the contributions of the RP activities and how they contributed to preventing sexual violence on a state level. That's something that we really didn't have the opportunity in the past to do with all of our disparate programs throughout the state. So really wanted to concentrate on putting together all that data from our funded local programs to look at what was happening throughout California and really be able to evaluate all those programs. One great outcome that came out of this is developing this partnership with Sabrina and her team at the Center on Gender Equity and Health. The University of California, San Diego has really been an integral partnership with us in getting a lot of this work done. And we hope to continue this partnership in the future to assist with evaluation toolkit training, implementation, data analysis, and lots of other evaluation activities in the future. As far as our CDPH deliverables to CDC as part of this supplement, we delivered to them an enhanced evaluation plan. As part of that, we really beefed up our outcome component that was in our current evaluation plan. In the last few years, it's been really concentrated more on capacity building, and the outcomes were based on, really figuring out what how the local rape crisis centers were implementing their programs and how they were doing it. We really wanted to beef up that and really look at outcomes more. With that, we also revised our logic model on a state level and tried to look at indicators and link those to the outcomes that were being addressed throughout the state. We also delivered a summary of our capacity assessment findings. We did a capacity assessment at our CDPH level and at the statewide level to really get at what our needs, our strengths, and our weaknesses were in our evaluation capacity at the state level. Our last deliverable was to really do a report on the implementation of these recommendations and document how we tracked the indicators on this at the upper state level. I'll talk a little bit more about how we looked at tracking the state level indicators. We really wanted to look at the and provide information on these state trends that could be used for prevention planning. So this data on the state level encompasses the whole state and wasn't really at the local community level, but this data we thought could serve as a baseline for conducting our state level program evaluation. Also, we use this data to look at our program evaluation in the future and an ongoing basis to monitor these changes over time at the state level. Some of these indicators that we are going to look at are on the BRFIS, the Behavioral Risk Factor Surveillance System, on the YRBSS, which is the Youth Risk Behavioral Surveillance System, and in California we also have a biennial survey called the California Healthy Kids Survey, which is a one component of it is a school climate survey, and another component is just on the health risk behaviors. It's similar to the YRBS, but we can look at the data from a district level, and then for some districts at the school level. So it's a little bit different, but it's given by the California Department of Education. So that's another survey that we can also look at. We also are including data on contextual factors, such as demographic data, school data that's specific to the schools that some of our RPE programs work in, criminal justice data, and some of the health disparities data that we can get from the wider data sources. So, as you probably know, though, that it's difficult to look at some of these state-level data sources and really tie it back to evaluation of our RPE programs. Our RPE programs, like I said earlier, are throughout our state, and California's a pretty big state, and we only fund 33 out of the 63 rape crisis centers. So there's a lot of the counties in California that are not covered, a lot of area that's not covered. So how do we put together those state level data with local level data and be able to use that data for evaluation? What we wanted to do with this was really look at these common elements that align the state level and the local level. What we did with all of our data sources that we looked at was come up with a state theory of change. From there, we looked at local program elements. So by examining all the local programs that our RPE-funded programs were doing in California, and we wanted to look at how these were aligned. So some of the other data sources we looked at to do this, we're looking at, we looked at all the current RPE outcomes and evaluation tools. We asked all of our funded rape crisis centers in California to kind of submit what they were doing as far as their own local evaluation, what kind of tools they were using, what kind of outcomes they were looking at. We also reviewed curricula from around the country. We reviewed the sexual violence prevention resource evidence base, and we looked at those public available data sources that I mentioned earlier. And I don't know if, Sabrina, you want to add anything to this process, because I know you were more involved in this. Okay. Okay, and this is, I know you can't read this. If you would like, we could also always send these out to you. We're going to send around a list. If you do want to put your name down, we can also always send out some of these tools. This is our statewide theory of change that we produced. There are a number of constructs here. On the left side, these are sort of our inputs, which include youth engagement, evidence-based sexual violence prevention approach, and at the bottom left, we call it a comprehensive school-wide community, staff, and policy components. So those are all our components that we feel like, or as part of the RP program, as inputs would produce these outcomes. Some of our constructs include, if you can't read them, I'll read them off, sexual violence prevention knowledge, skills, leadership empowerment skills, change in individual attitudes, self-efficacy, social connectedness, and leading up to behavior change, community sexual violence prevention behavior changes, and then social norms change, perceived school or community safety, and finally environmental structures to prevent sexual violence. Some of these are at the individual level, some of these are at more the relationship level, and some are at that community societal level. And we try to include these as points that we actually have at least one indicator for each of these constructs. So I'll move on to talk a little bit more about the evaluation toolkit that we are developing as part of this project. Developing the toolkit is the main component of how CDPH is implementing these recommendations that emerged as part of the supplement. While implementing toolkit isn't part of the actual supplement project, the project is mainly to develop it and really refine it and really get the tools established that are going to be in this toolkit. The toolkit will be implemented starting with a new RPE funding cycle in 2019. But for now, this is really how we aim to connect that local level with some of the data that we found at the state level. The goal of the evaluation toolkit is really to compile the data on a core set of indicators across all sites implementing the RPE program. So as I mentioned earlier, it was really difficult to get common outcomes, data on common outcomes from around the entire state, from all of our rape crisis centers. So this is our way of trying to get at that standardized set of outcomes and capture that from all of our funded rape crisis centers that do the RPE program throughout our state. We hope that this will improve our ability to assess our local and statewide impact throughout the state. And it also provides a set of evaluation tools that are pre-developed, that are accessible, that really set a standard for evaluation throughout the state. We came to the realization too that obviously there's a lot of turnover in a lot of the prevention positions. So what we found was that sometimes we would build the capacity of a lot of our RPE coordinators to do evaluation on this local level, and then they would leave for another position or something, they would shift positions, and then we would kind of lose that capacity. So this is kind of our way of giving something where it would be easily able to pick up and conduct evaluation with these tools. So we hope to take the burden off of like the RP facilitator and RP coordinator, and really have us be the ones who are designing this evaluation, who are doing the analysis of the data, and not have that burden be on the local RPE staff. We would hope that this would institutionalize these CDPH priorities for sexual violence prevention as well. I'll go into a little bit of our process in developing the toolkit. Our first step is that we met with an RP evaluation advisory group, and then we conducted some pilot testing with, we put a call out for some of our RP agencies to help us do some pilot testing with these tools. We got 5 rape crisis centers that said they would help assist with our pilot testing process. So we're currently in these tools are currently in development, so they're not final yet. So we're still currently working with these 5 rape crisis centers to develop these tools and to do the pilot testing. They're reviewing process and outcome data collection tools for us. So hopefully we'll have final versions ready soon. We're kind of at the tail end of this process, so hopefully we'll see something final in the next couple months. I don't know if you can read this timeline, but I just wanted to show you a little bit about this form that we developed just to show you the timeline of our pilot testing. We met with our organizations that were doing pilot testing, and we had them implement some of our forms. We have a community level outcome tracking form, a process monitoring form, and then our outcome pre-post survey. Those are the three main tools that are in our toolkit that we had them pilot. And you'll see just from the timeline that we have calls, check-in calls, and we're soon to have a wrap-up call with them in the next couple weeks. So the proposed toolkit contents, this is where I kind of wanted to get some of your feedback on. It's not intended to evaluate every component of the RPE projects for all the sites. So that's some of the feedback we got, was that these are some tools that might measure the impact of maybe a youth leadership group or one group that is involved with the RPE program. But it may not be encompass everything that the RP program does. So say if they have like a parent group or a another separate like meeting that they conduct with other RP participants, this may not be able to cover every single thing that the RP program does locally, but it does give them a core set of tools that they can use to evaluate their main component of the RP program. So that's really our intention with this, is to evaluate standardized set of activities throughout the state. One big challenge was that some of our RP contractors were saying that there's such a wide variety of programs and curricula throughout the state. Like, how do we get at these core contracts and core indicators that are included in these tools? So I don't know if other people in the state, or if your RP state coordinators have this issue, but how many of you are RP coordinators and fund more than like multiple programs that are doing different things throughout the state? Yeah, so there's quite a few. One of our struggles is to maintain that flexibility of having them able to conduct those disparate programs, but still be able to collect standardized data from them. So this was a great comment that I remember this from one of our evaluation advisory groups. That they called it the evaluation unicorn. We want it to be, flexible enough, but really we want to be standardized enough that we can actually collect data from everyone in California and have it be something that we can analyze and tell the story of what's happening throughout their state. So I don't know if anyone has any ideas about how they handle that issue, if they have the same types of evaluations going on in their own state. Does anyone have any similar scenarios that have gone on or when you're doing evaluation? Nope. Okay. Well, we don't have the perfect answer to this, but we really try to get at those overlapping core outcomes that we saw that were overlapping among all of our RP programs. And that's kind of how we approached it, is when we started to smush together, if that's not a technical term, but like smush together all those outcomes and surveys and curricula that we saw throughout the state, we realized there was such an overlap between, even if you're doing, say, a bystander program or a gender equity program over here, there's a core set of outcomes that overlap, like a Venn diagram, I guess. But we took those core components, and this is what we put in our toolkit. So I'll turn it over to Sabrina. She's going to talk a little bit more about the toolkit contents and really the process about developing the toolkit and she'll show you some of the forms and surveys as well.
All right, thanks, Mina. So as Mina has mentioned and kind of alluded to, I want to break down a little bit more what is in this evaluation toolkit that we've developed. And the first part and the main part that you've been hearing about is this pre-post survey that RPE participants themselves would fill out at each of the programs. And so when we talk about a pre-post survey, most everybody knows what I'm talking about, but this is something that the participants take before they even start their learning in the program, and then at the end of the program. The second piece is a process data collection form. And so when we implement this, RPE staff would be filling out on a monthly basis what sort of program they've been implementing. So how often have they been holding sessions? What kind of content, what risk and protector factors they be addressing during that session? Who's actually participating in the program? What are the characteristics of those people? And having this type of information really helps us to understand what was actually implemented. So when we're looking at all these different programs across the state, we really have a sense of, okay, these participants got a really high dose of programming, so they got a lot of information, a lot of engagement. These participants maybe got a little bit less, and are there differences between those types of participants and what outcomes they're showing? The third piece is this community level outcome tracking form. And so this is something that the RPE staff fills out themselves, and is something that they would fill out on a monthly basis and look at sort of all these iterative community structural level changes that might be going on in their community related to their RPE programming. So this is things like, on a really high level and exciting level, policy change or protocol change around sexual violence prevention. It might be implementing trainings with law enforcement or school staff. It might be leadership buy-in, so maybe a principal having some more interest or taking some initiative around sexual assault prevention, or a politician, or maybe some business leaders in the community. So we want to make sure that we're tracking those types of things. And not only do we want to track sort of the high level, like, you know, bam, a policy was changed. That's huge. But that might have taken 10 years to get to. So I'll show you an example of our form, and you all can see a little bit of how we've tried to capture some of those iterative steps along the way to get to the big policy change, for example. But we're still, you know, brainstorming about what are those community level changes that we want to capture, and how can we capture sort of the iterative steps along the way. The last point that's up there is not necessarily another instrument that's in the toolkit, but it's something that attaches on to the pre-post survey for the participants. As Mina's mentioned, there's a lot of diversity in approaches to RPE, and so we've tried to include modules that tack on to the pre-post survey that are specific to the different approaches, and I'll talk a little bit more about that in a second here. So, as Mina's mentioned, we have in our pre-post survey at least one indicator for every element on that big theory of change. And that big theory of change that we have at the state level now is what really is guiding sort of the priorities for RPE work in California. And so we really want to be able to institutionalize those priorities, and so by making that part of our outcome survey, we're really able to say that, you know, whether you're using a gender equity approach or a bystander approach or a community mobilization approach, whatever your means, something totally outside of the box, at the end of the day, these are the things that we want to move forward, and these are the things that we want to be tracking over time. So, of course, when we do that standardized way of doing things, we also need to account for some of the diversity, and part of that diversity is the wide variety of participants that organizations are working with. So we've tried to adapt our survey in a way that can fit a lot of different audiences, especially differences in age groups, from middle school all the way up to adults who are not in school or way beyond school. And that's tricky, and it's not maybe the most scientific way of doing it, but it's a very accurate and very valid way of still being able to pile together these data. At the end of the day, whether these participants were old or young, we can still bring the data together. So, for example, in the adult programs, we can talk about sexual assault, we can talk about sex, we can talk about dating relationships, but in our middle school audiences, we have a number of settings where the word sex is not allowed at all in schools, and so we are, let alone, not allowed to talk about sexual assault. And this is true for the programs themselves. And so those programs have given us that feedback through the pilot testing, and we've been using terms like healthy relationships and peer abuse. And what's sort of interesting is that then have an indicator that uses the term peer abuse, for example, or healthy relationships. But it's similar enough to that question that we asked adults around sexual assault or sexual harassment, and can bring those two together and be able to at least summarize in some way. We can also then do analyses by age group and whatnot as well. But it's a powerful way to bring those together. And then the different approaches that we are sort of thinking of with these modules that we attach on to the pre-post survey are healthy relationships, bystander intervention, gender equity, and then community mobilization. And so in addition to this core survey that we've been talking about, there's a module of additional questions, about 5 to 10 additional questions that get at sort of this specific approach. And many programs are doing sort of a variety of these things, like maybe not just a bystander intervention, but they're doing some of a little of all 4 of those approaches, and that's fine as well. It's really up to the organization which modules they want to plug into. And I'm going to try and show you the tool here, and I apologize that I will have Mina help me get. So this is an example of our more youth-oriented, like high school age gender. So it's the core survey plus the gender equity module. And so we've, something that is tricky with doing pre-post surveys, and maybe many of you have dealt with this, this actually we've modified in different ways and are still working on it. I think it might be one of the hardest pieces of this, is when you do a pre-post survey, you could do sort of a cross-sectional thing where you say, like, we're just going to collect data from everybody, and then at the end of the program, we're going to collect data from everybody, and we're going to pool those piles together and then compare them. Or you could actually try to track the individuals. So like, you know, person A responded this way at the beginning, and then they responded this way at the end. But the tricky thing is, how do you match up that data when you're trying to do it on a mass scale? And especially with like not a lot of time, and you want to try and keep the survey confidential, all of these things. And so one technique that's used is doing sort of a self-generating ID code. And they're tricky. They're really tricky to get. How do you ask a question? So basically the questions here are trying to get at basic like identifying questions. When put together, you could really identify this person, but it's cryptic enough that like somebody just looking at that code on a piece of paper doesn't know who it is. Has anybody used these before? Great, I see a few hands. And I'd love to hear, after I say a little bit more, I want to hear your thoughts on using these. But it's really tricky to come up with questions that people will be able to respond to, and then like easily, not even trying to remember a year later, but like easily come up with the same exact responses a year later. So that at the beginning, they're generating their ID code, and when they do it at the end, they're generating the same ID code and not another one. So I want to hear from folks. Has anybody had experience with these? What questions have you found helpful? Which ones have you found not helpful? Go ahead in the back. Oh.
Sorry, I need to run the microphone for accessibility purposes. Oh, there's one back there, perfect.
So we did last 4 digits of phone number, which I think is a pretty common one. I would say it worked-ish, partially because, I mean, phone numbers can change, but also partially because kids kind of make that hard sometimes. Like, they intentionally don't use their phone number because they think you're going to figure out who they are. So yeah, I found it challenging with youth in particular, but I think about half of them it worked, so
okay,
that's not horrible.
Yeah, that's great. That's really interesting to hear, and that's a great number that, like, you know, a teacher or a principal or another student looking at wouldn't know necessarily who that belongs to. Great, thanks for sharing.
Did you have a lot of responses, like the kids that didn't have a phone, or the participants that didn't have a phone number, that they didn't put something down?
You know, I don't know if that was the case necessarily. It might have been. But there were quite a few that just put all zeros or something like that, that it might have been that they didn't have a phone number. it made it very difficult on my end. So it was frustrating, and I'm glad that you just brought that perspective into it, because I should think about it that way, that it might not be that they're trying to make my life difficult. It just felt like it at the time.
You know what? Hold on just 1 second. We're going to bring the microwave, the microphone over.
trying.
I can bring a microwave as well for a little snack.
I was just thinking, and we never use it, but I thought maybe with the ID number at school, because every kid knows since, elementary, you have an ID number identified. So I think we're going to try the ID number, because it's true, to get it, we used to with initials, but then if he put the middle initial, or they don't want to respond because they thinking we're going to track them, I think maybe the ID number can work.
That's a great idea, and something we should talk to our schools about. Is that actually, are they all using IDs, and do the students know them? But I know sometimes schools post grades and things like that using ID codes. Go ahead.
When you have some information that the teacher might be able to identify the student, we make sure that when the students turn in the surveys, they go into an envelope, and the envelope is sealed, and we have them read those instructions so that they know that their teacher's not going to look at it and obviously know who they are, because maybe they do know the school number or the information on there. So that was really important to us, to show that it will be sealed and your teacher won't be able to figure out who you are and look at your responses.
That's great. That's really helpful. And so it's actually a physical thing that they see that's like nobody else is getting into this. Good.
Not specific to ID numbers, but kind of related. I was wondering if you had looked into doing retrospective surveys instead of pre-post surveys, because that would alleviate the need to collect or create some kind of ID and then do matching across.
Yeah, something, I think that it is definitely an easier approach to do the retrospective surveys. And so this might, for example, be where at the end of the program, you ask the students directly so before you started this program, what did you think about X, Y, or Z? And then now, what do you think about X, Y, or Z? And it's a method that can work. You tend to get a little bit skewed answers, or you don't quite know if they're remembering correctly what it was they thought before the program. And so a more sort of rigorous way of doing it is actually doing the pre-post, though much more difficult. Yeah. Oh, you know what? There's another.
Sorry. So I actually, I made flashcards with A through Z on there, and I had my students to pull them, and that is their buddy. So that stayed with them. I didn't even see which one it was, but it actually worked in almost 100% of correct, because they get to pick on their own. I gave them choice. They looked at it and they put A at the top or C, but that number that stayed with them. And so I have 2 A's and then 2 B's and 2 C's, and it worked for me. So it was a good idea. No one else knew, and I was able to identify at least the pre and post surveys by that.
That's really interesting. So did you ask them to remember what letter they were given?
I did.
Okay, I see.
And they kept it. So it's actually really cute flashcards. I deal with a lot of girls. So in girls particular, I made them bedazzled. And so they kept it, and I just didn't get to see it. And at the end of it, if they kept it, I gave an incentive. So if they had it at the end, kept it so they wouldn't forget or something, just in case they wouldn't, would forget A or B, I gave them an incentive, but it worked.
That's great. I can envision that being really useful with sort of we've got some programs that are smaller and sort of a really intimate group, that you've got a lot of contact with, but a group that you might be working with really long term. I could see that still working there, and I think that's a great idea that we should suggest to our participants. And then in a setting where you're working with maybe 1,000 students across the school, it might be harder to do. I just have a feeling they might not remember it, but I think that's a good point to not forget that there are settings where students might remember their code. So that's great. And a simple one like that, like A, B.
We actually use very similar questions. We do 4 questions asking their middle name initial, and if there is no middle name, then they would select X. But the format that we do bubble in, and we have probably a 90% rate of matching doing that. Wow. So I think we did transition from writing in to bubble in, and it did make a huge difference in collection. So it would be, I think the 4 identifiers are middle name, how many siblings, and your parents' first initial. Those are like one of the identifiers I have. I can always follow up and provide them to you.
Yeah, that's great. That's
to
really,
give you an accurate,
that's
to give you
really
the accurate questions.
helpful to hear. Sort of just even that change of filling in versus bubbles can be really helpful. We'll do one more here, and then we'll keep looking.
The questions remained the same too, so the questions
yeah.
weren't different. So we did see that difference in just the writing into the bubble end.
Interesting. One more here, and then we'll move on.
If you're aggregating all these up to the state level, I would also suggest adding the name of the school and the grade that they're in, because those can be that common combination across. So.
Yes, very true, and we'll be doing that as well. Great, thank you so much for all those perspectives and experiences to learn from. It's in settings like this where we really have some collective learning and things that you've spent years working on and have perfected. It's great to really hear about that. All right, so this is the survey. We do some demographics to begin with, and then get into some of those indicators or those questions that reflect the theory of change. So things around empathy, things around self-efficacy to create change in school, feelings of belonging, safety at school, teachers sort of like getting at some of the structural or community level norms at the school of, do teachers and staff really know how to respond, or do they really set the tone that sexual harassment and sexual assault are not acceptable on campus. Let's see. We've got some knowledge questions in there, looking at how, other forms of violence, bullying and domestic violence, how are they connected to sexual assault? And then I want to show, we've got some behavioral things around, like, I know how I would respond in certain situations, how likely am I going to respond? And then actually in the last year, how many times have you done those things? A lot of it kind of getting at bystander behavior. And then these last few, let's see, let me focus on these ones here. So 27 and 28, this is sort of the last bit of the core survey before we get into some of the gender equity specific ones. They're very small, but I'll read them to you. It says, please indicate how you think your friends would respond in the following situations. If I told my friends I pressured someone into doing something I pressured someone into doing something that person didn't want to do, my friends would likely. Or if my friends saw me try to stop another student from pressuring someone into doing something they did not want to do, my friends would likely. And different versions of this actually talk about sexual harassment and sexual assault directly. This is more that middle school version. But the responses here are, would my friends think better of me, think the same of me, or think worse of me? And these are some of our questions. We have a few more that are trying to get at some of the norms around bystander behavior or around sexual assault, sexual harassment behavior. And this is another way that we're trying to get at sort of this higher level of not just the individual, but trying to get at what's sort of the environment that that these RPE participants are in regarding sexual assault. Do they perceive that it would be socially acceptable to intervene and do something to stop these negative behaviors, or are they actually feeling encouraged or like that their peers would support them if they were to engage in some type of sexual assault or sexual harassment behavior? And so these ones are tricky to get at, especially when you're only asking at the individual. There's other ways to measure social norms that you're not just asking individuals, but when you just have access to the individuals, this is one way you can do it. But I wanted to kind of throw out there, have other people tried to measure social norms in their surveys, and how have you done it? Let's get that microphone to you.
Excuse me. So we haven't actually designed our own survey geared at measuring social norms, but our RPE project was based around 4 social norms, and we would select standardized measures that aligned with each of those.
Do you have any examples of what those social norms questions sound like? I know that's hard off the cuff.
It is, and I was just looking at one of them yesterday with a coworker, so I really should remember.
That's okay if you don't too.
But I mean, there are things from like the Illinois Rate Myth Acceptance Scale we used. We used GEMS, if folks are familiar with that. There's this really cool social dominance orientation scale that we used for normalization of violence, and it measures like belief in hierarchy. So that was really cool. But I can't think of specific questions off the top of my head, sorry.
No, that's great. I'm familiar with 2 of the 3 that you said, and I know GEMS does a lot of questions around like people in my community think X, Y, or Z, so we've got a few of those as well, sort of like people in my community think, or people in my school think this is okay or this is not okay. So that's one other way to do social norms. Anybody else have thoughts? I asked this one especially too because I know that a lot of us are interested in how do we measure the community level outcomes? How do we measure social norms? How do we get at that higher level? I see one more hand here.
So for the first time this year, we implemented the Athletes as Leaders program at a school, and one of the survey questions was along the lines of, my school is a safe place, or I feel comfortable here. And what we found, interestingly, is, we were able to track it through the individual and see how they grew. And a lot of times for those types of questions, we actually saw negative response on the post-test. And when I was talking to other people who had implemented Athletes as Leaders, that was kind of a common thing that they had seen as well. And the only thing we can think is they're now more aware because of having gone through the program. So it looks like it's getting worse, but really it's just because their knowledge has increased.
That's so interesting, and I think that's a helpful thing for us to keep in mind, that we might see similar patterns, because especially in a program like that where they're really trying to coach youth to take more action and do these things, they might be butting up to that resistance a lot more than they had when they were just, not even talking about these issues among their peers. But that's a great point. That's really good. I see another hand here.
Hi, my name is Randine. I'm with the Headquarters Department of the Army Sharp Office. I'm a sexual assault response coordinator. With that being said, the soldiers that I received from high school and college, most of the reported victims and reported subjects are between the ages of 18 and 24. And the normal behavior that they comes with the Army is different, what is considered sexual assault. Like if you smack a female or a male on the buttocks, they consider that abusive sexual contact under sexual assault. And most of the females would tell me that in high school, that's what the guys are doing. They will kiss them and run away because of a dare. Or they will smack them on the buttocks and run away because of a dare. Or they'll be having sex in the latrines, the restroom, because that's the norm in middle school and in high school, which as a trainee, that's not normal, but that's what is going on in high school, and they bring it into the military, and now they're a subject to an investigation for sexual assault because they do not know that that is sexual assault according to the military.
Very interesting. I think that's a perfect example of how norms are shaped and how our perception of norms are shaped by sometimes what we've been exposed to, whether that's other people's behaviors or that's the media or music or all sorts of other perspectives, even, how our government and whatnot is structured, things like that, all kind of tell us things about what behavior is acceptable and what's not. So good. Lovely to hear about other social norms. They're very challenging to measure. I will move on. So we have a few more. These are some of the questions around gender equity. So we get a little bit more into, I would be friends with a guy who acts more feminine or a girl who acts more masculine than others. It's okay for a man to say no to sexual activity. If a woman says she does not want to kiss or have sex, she really means it. Things that are getting sort of at the core root problems related to gender equity and how that relates to sexual assault. So I'm going to